Are you looking at becoming a medical social worker, and are you wondering what skills you might need? Well, in this video, I'm going to go over the top 9 core skills I think you need to be a successful medical social worker. My name is Tabby, and I'm a licensed clinical social worker with over 12 years of social work experience in the healthcare field. And I'm here to bridge the gap between what you learn in social work school and real-world experience. So my goal is to help social workers successfully enter the medical social work field. So I asked my colleagues and myself, what are the core skills someone needs to become a medical social worker? Medical social work isn't for everyone, and that's okay. But if you are interested in becoming a medical social worker, the skills I go over today are an absolute must-have. Skill number 1, prioritization. So you definitely need to have the ability to prioritize your day. Medical social work is a very fast-paced environment, and you need to be able to understand what your needs are and what are more important. And you have to be able to reprioritize your tasks throughout the entire day. The second skill is adaptability. As social workers, we have to be able to adapt to the situation. The only constant thing is change, especially in the healthcare setting. You'll need to expect change and adapt to it accordingly. Be flexible. Number 3 is resourcefulness. As social workers, we have to be very resourceful. We have to know what our resources are, and we need to know how to connect people to those resources. And although being knowledgeable about the resources in our community to connect our patients to is very important, something that's even more important is also being knowledgeable about the resources that are available to you as a social worker. It can help make your job a lot easier. One of the most important skills, and one of the skills that social workers struggle with the most, is boundary setting. It's important to maintain strong boundaries between you and your colleagues and your patients. But it's also extremely important for you to clarify and identify your role as a social worker amongst your colleagues and the people that you work with. And that means ending your day on time and not doing a lot of extra things. I know that's hard, but it's super important that you do this as a social worker. Another absolutely necessary skill that you need as a social worker, especially in a healthcare setting, is critical thinking skills. Social workers wear many hats. And what they don't tell you in social work school is that one of those hats is being a detective. You have to put a lot of puzzle pieces together. You need to anticipate what your patient is going to need to have a successful discharge. We all hear how important it is to have good communication skills. And that is true for relationships, friendships, and especially professional relationships. In the healthcare world, it is much better to over-communicate than to under-communicate. It's important to be clear and concise and update everyone when changes are made. The next one is relationship building skills. And you should already have this mastered when you become a social worker. Building rapport is important when we are working with our patients, but it's also important when we are working with our colleagues and people that are involved in the patient's care. Building rapport with our patients is very important, but it's just as important to build relationships with our colleagues and other community agencies. So for example, I make it a point to visit skilled nursing facilities, rehab hospitals, and other places I might discharge patients to on my days off. Now, this may not be necessary, but for me, it was very important to really understand and know what kind of resources and places I'm sending my patients to. So I joined a networking group on Facebook that connects the different hospital agencies and home health care and hospices in the community together. And I made sure that I built relationships that way. This has really allotted me the benefits of being able to connect my patients to these resources, even in times when it may not have been possible. Also, joining that group really helped me to gain access to continuing education credits and things like that, and opportunities that I wouldn't have had otherwise. Number 8 is teamwork. So you work with an interdisciplinary team, and if you've looked at my other videos, you know what that is. And because you're part of this team, you need to understand your role and everybody else's role and how they interconnect and how you can help each other. One of the things that drives me crazy is when people say, that's not my job. Well, the thing is, it is your job. Your job is to make sure patients get what they need. We may not specialize in certain areas, but it's at the end of the day, it's about making sure our patients' needs are met. So instead of saying, that's not my job, I find it important to be the one that answers their question or directs them to the person that can answer their question. We're all part of a team. And number 9 is you need to have a sense of humor. Being a social worker is tough, no matter what field you work in. Having the ability to laugh about situations, even dark humor, can help you find relief in stressful situations. Laughter lowers our cortisol levels and improves our overall health. So make sure that you laugh. So those are the top 9 core skills I think you need to be a successful social worker in the healthcare field. Thanks for watching, and if you enjoyed this video and want to learn more, make sure that you hit the subscribe button below so that you can be notified when new videos are uploaded. Also, make sure that you sign up for the Social Work Mastery newsletter to get tips, and resources on how to be a more efficient medical social worker.